North Goa District Hospital, National Tobacco Control Program.
I am Cecilia Fernandez, ADI of MAPSA Parties.
I am Frida.
Educational zone. Okay.
Frida Andrag, ADI ADM of Bardez Taluka.
Municipal Inspector, Valpa Municipal Council.
Ishwaraj Goekar, Inspector Legal Metrology, Department of Legal Metrology.
Aditya Parab, Inspector Legal Metrology, Vijayawada.
Rajesh Nengolekar, Inspector Legal Metrology, MAPSA.
Very high and large, right? So if this number is so large, then of course we can categorize it as something known as an epidemic, where a large number of people are suffering from a particular problem at once, right? So is tobacco really an epidemic? Is it localized to a certain area or is it prevalent everywhere? Is something that we also need to understand. I'm sure everyone is aware of different types of tobacco products, right? Can you all help me out then? We have two main categories. One is smokeless and the other smoked forms, right? So in the smoked forms you have your cigarettes, hookah, BD, anything else? That's all? Vape, yes, thank you very much. So e-cigarettes, vapes, which are more common and prevalent nowadays, especially among the youth. And in the smokeless forms we have gutka, henny, areca nut with tobacco, pan with tobacco, all of that, okay? So, of course, with time, as time is moving forward, tobacco is also sort of getting modernized, you can say, by this very example of a vape or an e-cigarette, which again, I would like to emphasize, is getting more and more in fashion nowadays, especially among the youth, and being advertised specifically as a product which is helping you inhale less of the harmful substances that a normal cigarette would have, which is not true, by the way. So heated tobacco products or e-cigarettes. This image here shows how an e-cigarette actually works. It has a battery, it has a heating element, and it has a liquid which basically contains a mix of nicotine along with any other solvent. So short films, or even on the packet itself you have certain rules, of course, that it should be showing that this much or smoking causes cancer, or smoking kills, all of that. But once the patient is, or once the person is habituated to this, they tend to really ignore those signs and symptoms, right, which are right in front of them. Now there is something known as second-hand smoking. I'm sure everyone is aware of it, right? So if someone is smoking while you're in the room and that person is not a smoker, so they can...
we have been providing technical support to Ministry of Health and Family Welfare and State Government. Overall, if you see, with presence of NGOs, we have presence in 27 plus states in India, and I am happy. Thank you, ma'am, for the invitation, and State Tobacco Control Cell for the invitation. And I think we are looking forward to interactive sessions. And the objective of the workshop is to better understand enforcement in terms of tobacco control. So we will be talking about a lot of legislations at national level, and also we'll be seeing how those legislation have been amended, to tackle emerging challenges in tobacco control. Okay, and I think Goa is unique when it comes to prevalence of tobacco use, which is one of the lowest in India, around 9.7, and if you see for India it is 28.6%. So the session will be taken, but uniqueness for Goa is basically due to large influx of tourists which basically comes every year. And I was checking out the report in the morning. I think more than 1.4 crore tourists in 2024 visited Goa. And when tourists visit, we understand that they are basically representative of India only. So there are some tobacco users also. 70 lakh tourists are adult, and out of them, if you count, around 28% are tobacco users, and around 3 to 4 lakh are smokers which are visiting Goa. And if they are doing only one violation, that there are some violations that are happening in Goa also. And when you try to compare it with the challan number, it doesn't match. So we need a long way to go when it comes to tobacco control in Goa also. So I'm happy and thankful to the State Tobacco Control Cell and District Tobacco Control Cell for organizing this event. Thank you so much.
Sikal. I'm a physician. I was associated with DHS and District Hospital Goa, MAPSA, for almost 10 years. I just left for good and I'm doing my private practice. I'll be discussing about this. Yeah.
Good morning, everybody. I am Dr. Nandita Nadkarni. I have just taken over as the District Nodal Officer for Tobacco Control. So I am also new to all this, but still we are working forward to bring about this national program to our state and to district level also. So hopefully Dr. Puneet will help you tackle all the challenges that you are whatever for COTPA.
आज आमी हांगा एक दिसाचे ट्रेनिंग दवरिल्लें आसा फॉर लॉ एनफोर्समेंट ऑफ कॉटपा एक्ट. हे आमी सगळे म्युनिसिपल कावन्सिल्स आनी पंचायत आनी लिगल मेट्रोलॉजी, एज्युकेशन डिपार्टमेंट, ट्रॅफिक, KTCL, मोपा एअरपोर्ट, सिव्हिल सप्लायज हांकां सगळ्यांक एक दिसाचें ट्रेनिंग दवरिल्लें आसा सो दॅट दे कॅन एनफोर्स कॉटपा एक्ट and control the use and distribution sale of tobacco products in our state so that we can provide a tobacco free environment for our community.
Your name please?
I'm Dr. Nandita Nadkarni. I am the DNO for the District Tobacco Control Cell placed in Azilo Hospital, Mopsa.